Hello, I'm Dr. Anthony Wheeler, and I'm going to tell you everything that you need to know about pathology. You're probably wondering what's going on with this image here on the right. It's a peripheral blood smear of a patient that has paroxysmal nocturnal hemoglobinuria. If you were a pathologist, you'd be able to point out that there is hemolytic anemia occurring. I'm going to teach you that and a bunch more. Make sure you have this book. All the material is covered here. This is the home base for all our discussions. Medical school pathology and step 1 review. Anemia. What is it? Well, anemia is characterized by the reduction in circulating red blood cell mass. Notice all the white space between these RBCs. Notice the breakdown and abnormal shape of a lot of these red blood cells, anisopoikilocytosis, something like that. Anemia leads to a reduced flow of oxygen in the body. If you think about it, you know red blood cells carry oxygen on hemoglobin. If there's less red blood cells, there's less hemoglobin, and there's less oxygen being transported. Some common signs and symptoms of anemia include hypoxia, weakness, lightheadedness, fatigue, dyspnea, pale conjunctiva, pale skin, and headache. Hemoglobin, hematocrit, and red blood cell count are often used to determine red blood cell mass, since it's technically hard to measure. These are key values to remember. Anemia is defined as hemoglobin less than 13.5 grams per deciliter in males, and a hemoglobin less than 12.5 grams per deciliter in females is anemia. And note these are for adults. This is a very important slide. Remember 80 to 100, okay? Because anemia can be classified into 3 basic categories. If you know the cutoffs, you'll be great for life. It's always going to come up. Those categories are based on the mean corpuscular volume, the MCV. For microcytic anemia, for all intents and purposes, the MCV is less than 80. For normocytic anemia, the MCV is equal to 80 or somewhere in between 100. So 80 to 100, normocytic anemia. And for macrocytic anemia, you need an MCV greater than 100. And that's the end of this short lecture. Okay, it was a very short one. This is a primer because we're going to talk about all the different types of anemia: microcytic, normocytic, and macrocytic. We're going to discuss those. I'll be sure to link them so that they are easy to find. Make sure you keep studying, keep reading, keep reviewing. You got this. I believe in you, and I'm going to be here to make sure you do the best. Okay? Keep studying. Talk to you later.